and welcome to the Huddle. This is our live podcast brought to you by my sports dietitian. I'm your host, Margaret Downs, and I am a registered dietitian, board certified in sports nutrition, and also a certified exercise physiologist. I am here today with some wonderful dietitians. We're all here to talk about sports nutrition and just general health principles as it relates to sport and how we help athletes win. So today we're joined by two fabulous dietitians that have agreed to come on and talk about a really not only popular topic right now, but one of great importance to our overall health and longevity for really any person, not just athletes. And so can't wait to get started and learn from these ladies about some things that they're doing. And just to introduce Dahlia Gordon, Dahlia is a registered dietitian. She is in the Charlotte, North Carolina area, and Dahlia is a former Division I athlete. She has experience working across all levels of performance and with all types of individuals, from youth to amateur competitors, elite and professional athletes. She has, experience as a collegiate athlete, and her clinical expertise is to really help clients fuel effectively, perform optimally, and build sustainable habits. In addition to her private practice in Charlotte, she also leads food as medicine initiatives at Levine Children's Hospital, and she helps to address food insecurity and advancing holistic care for pediatric patients. Welcome, Dahlia. We can't wait to hear more from you. And then we also have Courtney Colbert. She is a registered dietitian, and she is also began her career as a competitive athlete and had frustrations by digestive issues and restrictive diets. Her personal health challenges inspired her to pursue dietetics, and she's blended the sports nutrition and functional gut health to help others overcome similar struggles. She has over 5 years experience as a registered dietitian, specializing in this area of gut health, sports nutrition, and metabolic function. And she enjoys using a science-backed approach, integrating diagnostic testing like GI mapping and genetic analysis to uncover root causes of digestive disorders and optimize performance. So, welcome, ladies, and thank you so much for joining us today live on The Huddle and my sports dietitian.
Thank you.
So I just want to start off and let you both introduce yourself, kind of tell us a little bit about your practice, because I know you're both running your own private practices as well as doing other things. Like most dietitians have wear multiple hats, and so just give us a little bit of background about you and where you started, Dahlia. I mean, obviously you came into this as a Division I athlete and have some working knowledge of being that athlete, and then how you kind of sprang into practice and what you're doing now.
Yeah. So I actually became a dietitian because of my athletics and my involvement in it. When I went to college, I realized pretty quickly with just the increased training how much what I ate really impacted my performance. And I remember thinking like nutrition is like magic in sports, just because it can make such a huge difference. And so after my freshman year, I actually switched into nutrition. And I don't think I knew what a dietitian was in high school until I was actually in school, in college. And one of my teammates was like, oh, yeah, there's actually a whole field for nutrition, and a dietitian is what you become.
Yeah,
So that's
me
kind of
either. I
where,
didn't know that either. It's wild, right? You kind
yeah,
of
it,
connect.
yes. And
Yeah.
so I switched my major, completed my education to become a dietitian. And then in my practice, I really started with my major focus being in sports nutrition and really wanting to focus in on that aspect of it just because it was so important to me. As I started working with individuals, though, there are so many ways that we can help people with nutrition, regardless of if they're an athlete or not. And so my focus kind of broadened to more general wellness, preventative health, and then just what we can do to optimize not just athletic performance, but our entire lives. And in that, I started to see a lot of gut health. And so that's kind of where that connection came.
Yeah. And I would be remiss if I didn't acknowledge that you helped actually teach and train me some in this area, and I learned a great deal from Dahlia to even like in my own realm before I even really kind of knew this was a thing. So, um, know that you're so talented and very experienced in being able to work with people who have these challenges, but also as in terms of longevity, what that means, from a preventative standpoint as well. So I can't wait till we get into talk a little bit about that. So Courtney, I know you are also on Nourish, correct? Are you also on
Yes.
the Nourish platform? And
Mhm.
so that's how we kind of connected as well. But I'm just interested to find a little bit more about you, your private practice, which is Fuel and Flourish Sports Nutrition. Is that correct? And
Correct. Mhm.
yeah, and kind of what you're doing in your own practice and what's going on.
So I think like most dietitians or those who have kind of gotten into the health and wellness field, I unfortunately was introduced to it in a more negative aspect. If you look back on it, in the sense that in middle school, high school, I actually was not an athlete by any means. I did, soccer and a few, sports here and there, horseback riding. My sister was kind of the athlete of the family, and I did marching band and music and all of those things. And I was kind of, going through middle school, going through high school, and developed some, pretty unfortunate disordered eating patterns that have eventually led to a very, very deep obsession with, fitness and wellness and, the optimization of health, which at the time I didn't realize was unfortunately very, very toxic for, such a young, I think I was 12, 13 at the time when I went on my first diet. And through high school, I was kind of, struggling alone with this eating disorder. Didn't really know who to talk to about it, didn't know that there were resources out there. Social media at the time was just overwhelming with, like, I think Tumblr and like Instagram had just started coming out. So fast forward, kind of, dealing with all of this, moving into college, I decided that I was going to get into the gym and start working out. And I dabbled in weightlifting and started doing, bodybuilding competitions, which I thought would like fix everything. And the reality, unfortunately, was that ended up having the opposite effect, right? I had no idea at the time that, what I was doing was really just a disservice to my body. But at the same time, like, it put me in a position to graduate to where I'm at now and help others and be that voice and be that sense of support for a lot of athletes that are really struggling with disordered eating and over exercise, orthorexia. That was something that I really struggled with. And in college, when I was dealing with this orthorexia, I developed a lot of gastrointestinal issues, a lot of intolerances to foods, severe, like significant bloating, a lot of, constipation and abdominal discomfort and issues, even when I felt like I was eating like three foods. So I decided to use that as motivation for myself to kind of investigate, like, why was this happening? What could I do to improve that? And then as I started delving into the world of nutrition a little bit more, I was in the acute hospital setting in the ICU, dealing with a lot of acute care issues, everything from tube feeding to cancer to a lot of these very, intense digestive issues that I realized were very interesting to me at the time. And I just decided to run with that and investigate further. I ended up taking another job with another dietitian at the time who was practicing functional health, specializing in these GI issues. And I was realizing that like 80% of my patients, if not more, were also, competitive athletes, bodybuilders, and they were all having the same digestive issues that I felt like I was having. So I was able to connect with those individuals, and that's when I started learning about, GI mapping and the functional nutrition world. And from there, it really just kind of took off, because I found that it was so just interesting and insightful. I was making these connections, and we were, treating and healing people from the inside out, and it was just amazing to watch people's lives significantly change just by adjusting things from supplements to diet to lifestyle. So yeah, it was unfortunate kind of how I got into it, but I wouldn't change it for anything, because that's where I'm at now. So
Yeah, well, thanks for sharing all that. I mean, that's quite the journey, and also, personal relevance to, how you got to the point where you're now in a position to really impact and help other people. So I appreciate you sharing your background, understanding that I think a lot of people have come into the field, after experiencing some real challenges around food, especially previous athletes, right? And as we know, and I know as a sports dietitian that, eating disorders is a huge part of what we're doing, and how that can also be managed, from various different standpoints in terms of regulating the body differently, and how all of these things that we're ingesting emotionally can have
mhm.
an impact on our eating behavior. So thank you for all of that. There's so much buzz around this topic and gut health right now. And I was recently listening to another gastrointestinal physician who indicated that there had been about 50,000 studies that have been published in the last 5 years on this topic. And that was astounding to me. I thought, wow, I mean, we are really, the literature alone has come so far in such a short amount of time that as a dietitian, I feel like I've had a hard time keeping up with this. Like, wait a second, what's going on? So I just want you to tell us a little bit about, how would you define, from your standpoint, what do you define as gut health, right? When we even say that word, what does that mean? What are we talking about? Is it just regular bowel movements? Is it, the lack of having any kind of, adverse sign or symptom around our gut? Or what is the overall big picture when we're talking and defining gut health? So, Dahlia, maybe we can get your perspective first.
Yeah. So when I talk to clients about gut health, and even when I think about it for myself, I think of gut health as anything that's affecting like anywhere in our digestive tract. So that could be all the way from our mouth and our esophagus down to our colon, with everything in between. And so there can be a lot of things that can happen from start to finish, whether it's acid reflux, bloating, changes in bowel habits, like diarrhea is more common than constipation for athletes. And so those are the things that we can really feel, but also thinking about, you know, what that athlete might be at risk of, just in regards to their training. It's a lot of stress on the body, and sometimes that can promote some of the intestinal permeability and other issues that we don't want to see in athletes or anyone.
Yeah. Courtney, do you have any different, kind of varying definition of what gut health is to you?
I completely agree with Dahlia. A lot of the times I do kind of explain to my patients, when we think about gut health, it's not just, the stomach and the small intestine. Quite literally, it's, mouth to anus. So everything that is a part of that process, which is a lot of things, can influence and impact a lot of parts of the body, even things that might not directly seem correlated to digestion, right? So if there's a lot of food intolerances or skin rashes, or there, is a gut brain disconnect, like Dahlia was saying, there's a lot of issues that I see with, unmanaged or poorly managed stress on the body. And we know that those stressors feed very heavily via that vagus nerve. That parasympathetic nervous system is so heightened, I think, in a lot of these athletes. So we have to remind ourselves that gut health and the microbiome itself is quite literally the brain of so many other things, and even something like your immune function, right? 70% of immune cells are created in the gut itself, and that's a really big component. We think about things like serotonin, right, which is a huge neurotransmitter involved in your mood. If you think about something like serotonin, a large amount of serotonin is produced in the gut as well. So when the gut isn't functioning optimally, those other things that might not be directly correlated to digestion usually start to falter a little bit. So when I'm seeing those connections, I'm kind of picking up on those red flags a little bit to kind of build a bigger picture of, okay, well, let's start with the gut and see what's going on there.
Mm-hmm. Well, you bring up an interesting point, both of you, when you talk about stress, because athletes, I don't feel like they're great about acknowledging when their body is under stress. And they're just so used to being in that performance mindset and state, right? That's the state they live in. And so tell us a little bit about how stress can impact our gut health. I mean, what is it about that stress response that puts them at risk for, potential issues with this area of their body?
I think when you think about stress, I think sometimes we have to take a step back and really lay everything out on the table. I like to do a diagram drawing with a lot of my clients when we're talking about stress, pretending that your stress threshold exists in this like bucket in your body. And we have to acknowledge and recognize that all of these different stressors will fill up this bucket in different quantities, different amounts. So when we think about stress, there is psychological stress, absolutely, but there's also emotional, physical, anatomical, environmental. So if we're having any amounts of these stressors, gradually in small amounts, filling up our stress bucket, so to speak, and we're not emptying that bucket efficiently, now our threshold, our tolerance to be able to actually manage these stressors effectively gets smaller and smaller and smaller until a couple drops in that bucket send everything into overflow. So a lot of my patients will describe an environment internally or externally where they constantly feel like they're in fight or flight. And then I'll start asking them about their digestion and their sleep. And those two things are usually compromised because we're not giving enough attention to the other side of the central nervous system, which is rest and digest. So oftentimes when I'm seeing issues with recovery, chronic fatigue, issues sleeping, those digestive issues, we start really looking at stressors, because we know that when stress is on the body, we can't be in two places at once. So the downside is the absorption, the production of enzymes, stomach acid, breaking down nutrients efficiently. All of those things just kind of slows down and compromises because the body's too busy trying to fight whatever threat is present. Even if the threat isn't physical, the body's still primary goal is running away, getting away from whatever it may be. So in doing so, you're missing out on the recovery, the repair, the production of these, immune fighting cells, the production of all of these enzymes to help break down your food efficiently. Your motility can greatly differ in terms of, things running through too quickly, or maybe it's the opposite and you're really constipated and backed up because your motility can't really function optimally when the body's primary function or primary like mode of action is just running away, fighting, fleeing, whatever it may be. So we're missing out on all of those components because the body's trying to do too much at one time.
Mm-hmm. Yeah, really great points.
You said that so well. One thing I try to teach people that I work with too is really the basics. Like when we're exercising, that our blood flow and our nutrients and the things that we need to get going are going to flow to our muscles and away from our digestive tract. And with all the things that go on when we eat food and turn that into energy, our digestive tract really needs some blood flow and needs extra support, and it just can't do that while we're exercising, especially at an intense level. And so helping people understand how their body works, I think, is a key here, because obviously Courtney and I, know all of these complexities of stress and athletes and nutrition, but really, I think having the individual start to understand and kind of put the pieces together themselves, that, in my experience, has really promoted success.
Yeah, that's awesome. It's amazing because I think just they're not even aware, right, of like
Yeah.
the implications that being such a highly competitive person really puts on their stress response system. And I'm always amazed that, because I work with a lot of athletes and they just don't have it, they're just overriding that all the time, and the sleep is a real problem. And we see this even starting in younger athletes, high school age, really, adolescence. And so that sleep component really becomes an issue. And then that's another cascade of creating issues in terms of your circadian rhythm and being able to rest and recover properly. And so, I'm really interested in your perspective on the gut sleep, connection. And is it, just what would be your recommendations to help people reduce this stress and get better rest?
So I love to talk about sleep and stress. I tell people those are like the two things about people's health that they like to either disregard or
I love for
downplay.
people to talk to me about it.
Yeah. And sometimes when I'm talking to people and they tell me that they manage their stress well, but I can, feel it from the computer screen sometimes. I think athletes get into the mindset of like mind over matter, and I am guilty of it. Where when you've been an athlete, and that's been like your main focus, it's really easy to just ignore everything else, whether it's things that your body's telling you, little pains or aches, and it's just part of that, I think, drive of that a lot of athletes have. And so again, I try to explain why sleep is so important. And it really is a time for our bodies to do inventory and look for what needs to be repaired and replaced. And when we're not getting, our 8 hours of that, it's not just cutting out the time that we have for repairing, but it also is affecting our brain. And even though we think of athletics and sports as purely physical, there is a huge psychological and emotional component to it. And so we're really kind of cheating ourselves out of both of those benefits.
Mm-hmm. Yeah. Any other thoughts on that, Courtney?
No, I agree. I kind of want to just reiterate the importance of that. Optimal sleep is really that rest and recovery period. And when you are cutting it short, you really are doing the body a disservice, because you're missing out on all of that like optimal prime function. So no, I completely agree. It's something that I try to shed a lot of light on with a lot of my patients. It's always something we talk about in our analysis. The initial assessment, sleep is a big component. So if that is something that is subpar or not optimal, it's usually something we'll try to manage and mitigate. Maybe even before we start tackling their diet or other things. It may be that a lot of the root cause of their issues is very well surrounded around their sleep hygiene and their stress management.
Mm-hmm. Very interesting. And I know just a very common and very serious problem, for, people who are highly active in this area. And, it's not only falling asleep, it's staying asleep, it's being able to recover properly, which also can lead, as you both know, to, injury and illness, and now your time off of, out of play. And that just creates a whole nother cascade of issues. So yeah, where do we start? Right. So we know there's all this conversation around probiotics and prebiotics and the postbiotic effects. And, the 3 Ps is a big, thing. But, I feel like there's so many supplemental, like, marketing tactics out there now, and people don't always know what to do. And so, they may be guessing. And so I know in recent years, dietitians that I've worked with and around have been testing, not guessing, on how to maybe apply some of the supplemental protocols around helping people with their gut health and their microbiota. So, where do you start, in terms of, is it food first? And then, how do you start working toward assessing someone that is having some pretty serious digestive issues?
So I try to start with the basics when I see someone. And obviously, in assessment, I'll get as much information about what's going on, their diet, their health history, even family history can sometimes be important. And then talking through what they're doing currently. And then I always ask people, especially when they're having gut issues, like I ask them what they think it is, because they're the ones that are living in their body every day and feeling the symptoms and experiencing it. And oftentimes people have some sort of idea, or they think maybe this is it, and then I can go back and we can adjust the diet or do different things to kind of test that, or use things like stool tests or microbiome testing to really confirm. But from the beginning, I try to start with basics like intake. Are they eating enough calories? Are they eating the correct macronutrients for what their athletic performance needs? Meal timing is also very important. So are they getting in something before and then refueling after? And then food choices, obviously, but from my experience, a lot of athletes actually make good food choices. It's just more of a matter of the amount or the timing of it.
Mhm.
And so I use a food first approach. Some people want to be on supplements. That's like what they come in asking for. And I try to meet people where they are and work with, what their needs and wants are. But just personally, I try to use a food first approach just because food has a lot of cool things that it can do for our
Mhm.
bodies, especially in its whole form.
Yeah. And the synergy around eating a variety of foods, is probably more beneficial than taking supplements that we're not really sure. Although
Yeah.
I'm fascinated by the testing aspects of this, I've heard from some, like, physicians, in this area that, they don't necessarily use the microbiome testing as protocol yet, even though it's something that I feel like I've heard is definitely coming forward as potentially being a standard option for, assessment of the microbiome. But that, they're still looking for validation, in some of these tests that I know dietitians are actually administering and getting results from. And so I'm curious what your perspective is around that, since you're both working in some of that area. What have been some of the results from the testing that you've done? And do you feel like you've gotten good information that you can then base your interventions on?
I think, like anything, it's a tool that can be used. There are many, many cases where I won't do any testing, where I'll actually have a patient come to me telling me they, want to do a GI map or a food sensitivity test. And we actually don't end up doing it because after we've kind of gone through a full in-depth analysis and an intake questionnaire, I'm already able to just make a couple tweaks and adjustments to a few things that significantly improve their symptoms without even the need to, spend the extra money and time doing the diagnostic testing. That being said, it still can be a really useful tool when maybe there, are those really complex cases, or maybe you have a patient that for them, seeing data and seeing something kind of is a light bulb moment for them and is going to allow for them to feel more inclined to maybe make some of those changes and to have some of that validity that you're trying to encourage as a medical provider and an expert in the gut health world. But I don't always test. Sometimes I'll use it, sometimes I won't, but I've thoroughly enjoyed using the diagnostic testing when I have done it. A lot of really great information, can be gathered, just, like you're putting all the pieces together in a puzzle. So part of the analysis, and then part of the tool using the data to really build a clear picture of what's going on allows for you to, better maneuver and figure out what approach you need to take, which might be supplements. It might not be. The supplement world is like the Wild West, honestly.
Yeah.
It's a
And it's so
conversation that
confusing for people. I mean, they just, well, I even feel as a dietitian it's overwhelming, because
Yeah.
it's just so much. And I mean, every day, somebody brings something new in here and says, "Hey, I'm doing this." And I'm like, "What's that?" Like you're just having to
Yeah.
constantly stay on top of that. But it's, wow. Yeah.
Yeah. I use, several supplements in my practice that are, very reputable, evidence-based, third-party tested. But at the same time, I also really try to encourage what is the, minimum amount of dietary supplementation as well, right? There's a lot of talk in the functional medicine world that I've kind of run into, and maybe Dahlia, you can speak on this as well. Sometimes I'm noticing that there's this like idea that more is better, and like let's just throw all these supplements at you and then it can just replace your diet. And the reality is like we know that that doesn't work. And I love that you mentioned using a food first approach, because ultimately it really is the root of everything. Because most of the time, when we're making these tiny tweaks to an athlete's diet and they're able to eat some of these foods, even if it's like one serving of, fermented veggies or something, or some kefir in the morning before their practice, those tiny little, changes to their diet from a whole food standpoint can make a significant impact, rather than, spending all this money on supplements that you're probably not really getting much benefit from.
Right. Yeah, I agree. I mean, you often see very significant like changes with just a few, little tweaks in their dietary alignment. I agree.
Yeah, I like to also remind people that nutrition is a pretty new and like ever evolving field. And there's a lot of things in our food that we may not have identified yet that, nutrients work together when they're in a whole
Hmm.
food and they're designed that way. And so
Yep.
there's a lot of benefits to eating the whole thing, even if I can't tell you exactly what they are. And the other thing I like to ask people when because I see it a lot too, Courtney, where people are taking like 10 different supplements by the time that they see me. And I like to ask people if they plan on, taking 10 supplements in the morning and at night for the rest of their lives. And they think about it for a second, and usually they decide no. And so that can be like an easier segue to moving people
Hmm.
more towards a foods first approach and really educating people on where they can find some of these nutrients in their foods.
Yeah. Yeah, yeah. Well, I know, Daria, you have some experience with doing some microbiome testing as well. So,
Mhm.
what is your perspective on the usefulness of that assessment? And, do you feel like, I mean, where are we headed, with the potential for bringing this into a full spectrum capability, in our practice and in our toolbox?
Yeah, so I think it's gaining a lot of traction, honestly. And I say that because I also work at the Children's Hospital, and I have seen physicians order uh, stool testing, like GI
Hmm.
mapping for
Hmm.
pediatric patients in the GI clinic, which is something that, I feel like a few years ago I would have thought was unheard of.
Hmm.
But I'm seeing it more and more, and there are physicians and practitioners out there that do see this as a very useful tool. Like nutrition, research is always coming out and things are always changing. And so, do I think everything that we can get off of a stool test is 100%, what it's going to be 10 years from now? No. But I do think that it can help point us in the right direction and also really target different things. So,
Hmm.
on some of the um, all of the gut health tests are laid out a little bit differently in terms of results. But an example of how the tests can be very helpful is, for one, if someone is dealing with intestinal permeability, or say they come in with a ton of food sensitivities. This is like a pretty common one that I get. They come in and they want to do food sensitivity testing because they have all these foods that they're reacting to, and they have all these food sensitivities, and they want to figure it out so they can cut it out of their diet. And we go through the assessment, and then if there is what I think a gut or a microbiome related component, we'll talk about that, and I'll explain how sometimes those food sensitivities can be a symptom of something like intestinal permeability. And I obviously let people make whatever choice they want to in terms of testing. But being able to then get that stool test back and see the intestinal permeability, and they can see it on paper, just like Courtney said, that can make a huge difference. Just sometimes seeing is believing. And I'll admit, even for myself, even though I know what I know, if I see it on paper, I'm more likely to take it seriously.
Yeah. Yeah, that's awesome. So can you tell us what GI mapping is? Like, just for our listeners who may not have a clue, like, what is that? What does that, mean?
So it is a stool test. So the first part of it is you collect your own poop, which no one likes to do. But you send it into the lab, and the lab analyzes it for things like different strains of bacteria, different metabolites or enzymes from digestion or the foods that we eat, as well as inflammation markers. And it just gives us a lot of information about what's going on. So maybe not like one specific marker will tell us everything, but when we look at those reports with all of the different levels of bacteria or enzymes, inflammatory markers, that kind of paints the picture, and it gives us as practitioners a better idea of, one, what's going on, and two, how we can address it and move forward.
Yeah, awesome. That's great. So, how do you see this area of gut health evolving and changing over the next 3 to 5 years? Like, what kinds of things do you think we're going to be doing in our own, practices related to this topic in terms of how we're advancing? Because it seems like we're advancing really quickly.
We've come leagues, honestly, even in the last few years, from what I've kind of seen transpire is really interesting, because in the beginning, maybe, gosh, even 5 years ago, when I was having patients with GI issues that were going in to see, gastroenterology, they would do a scope, they would do, colonoscopy, they wouldn't find anything. They would say, oh, you have IBS. I don't know, do this low FODMAP diet and good luck, pretty much. And then they send them to me, and they're like, this was not helpful at all. I feel way more confused than I was before. Like, I'm doing this low FODMAP diet and it feels really restrictive, and it's like kind of helping, but I still have all of these issues. And like, but the scopes came back clear, so it must be in my head. Like, it must be me, right? And sometimes it's that ability to really connect with a patient and be able to like sit them down and explain that, like, you're not crazy. Number one, like, there are other things going on that, like, while those tests are great and they have their place, they're not going to be able to identify things like intestinal permeability or dysbiosis or a issue with like pancreatic enzyme function or hypochlorhydria or anything like that. So when we're able to sit in my office and talk about these other types of tests that we can do to build a better picture of what might actually be going on, they feel so much more reassurance, because they feel like after they've met with GI, it's just a dead end. They don't know what to do. They have this IBS diagnosis, and they just have to, live the rest of their life trying to follow this very restrictive low FODMAP diet, which, yes, can help with symptom management. But as Dahlia was saying, oftentimes when I'm seeing a lot of these food intolerances to things like FODMAPs or gluten or dairy, it's usually a pseudo intolerance that's being caused by, reduced intestinal permeability. And once we repair that, a lot of those food intolerances end up going away, which is pretty cool to see in practice.
Yeah,
It's so
fascinating.
cool.
I love
That's
it.
fascinating.
Same.
Yeah, you brought up IBS and,
My least
FODMAP,
favorite
right?
diagnosis.
Well, I mean, it's such a fascinating, I mean, oh my gosh. And, I listen to a lot of GI doctors on this topic because, again, I feel like I'm always interested in their perspective in terms of how they're assessing it and diagnosing it and then what they're doing about it. And there is certainly, I feel like, a progression from where we used to be to a more interdisciplinary approach at this point where we're hearing that all. I mean, it's just I mean, I don't know how many you would say if you had to sit here and say what percentage of your clients show up at your door and say that they have some history of IBS. But it's pretty significant, right? Like we hear it a lot. And what does that even mean? I mean, so I know we all have had this ongoing conversation about what it means, and I've heard some doctors talk about it and they don't even talk about inflammation. They're just kind of like talking about it as this kind of interesting diagnostic criteria that still is very uncertain. And I feel like that gives people very little information in terms of what they can do about it and how they can improve their symptoms and mitigate the constant aggravation and pain and suffering that they're in. So what is your perspective of IBS? And if you had a client that came in and told you they had, of course it's IBS-D, IBS-C, diarrhea, constipation, we've got these varying levels of things that can happen in that spectrum. But, what is your response to that diagnosis?
In my head, I usually think, okay, what's wrong with this person? Because it's IBS, I think of as kind of an umbrella term for you have
Yep.
something going on in your digestive tract, and I don't know what it is, so you have IBS now. Is just personally how I feel about it and what I think. And oftentimes when people come to see me that have IBS, we can usually make adjustments and figure it out, and it's a lot of times not IBS. But the other thing with that diagnosis is that people will start taking, PPIs or other pharmaceutical drugs that then it kind of starts to muddy the waters because you're like, okay, what was going on before, what's being caused by these different things that they're taking. Or I think one of you guys brought up probiotics earlier. That's another thing. People will start taking a random probiotic, not knowing that all probiotics are not created the same and they're not going to react the same within your system. And so really an IBS diagnosis is just like a heads up that we need to do a little bit of digging.
Mm-hmm.
Completely agree.
Great perspective. And then you brought up the FODMAP, which I feel like, we should at least comment on because so many patients are told to, get on this roadmap, to basically eliminate certain foods from their diet that could be potential causes for, the IBS signs and symptoms. So any experience with that you want to comment on, or any potential real validity for using it?
Yeah, and I think I want to emphasize I'm not discrediting the low FODMAP diet. I think it has its place and can be
Right.
extremely effective when it's used properly. And that's kind of I think the disconnect between a lot of providers that I've worked with in the past is they think that it's a fix all. Oh, well, if we eliminate these, fermentable carbohydrates that are causing bloating and pain, perfect, like problem solved. But the reality is that just gives you one small piece of information, right? As dietitians in the gut health world, Dahlia and I are working towards figuring out, why are you having issues digesting these fermentable carbohydrates? What's going on that's making you intolerant to begin with? So when I'm using a low FODMAP diet, I'm using it in a structured protocol where, we're going through things meticulously, and the ultimate end goal is to eventually reintroduce as many of those foods back into the diet as possible, while allowing for the patient to not have, an exacerbation of symptoms. So as we're reintroducing foods back in, it's really great because you're able to constantly test and see how the digestive health is improving and healing through the protocol. So every time that you're adding in more of these foods back in, it's giving us more information to see where we're at in terms of our gut healing protocol. So the ultimate end goal, I remind my patients, is symptom management number one. Obviously, we don't want to be, forcing patients to be eating foods that are causing problems that make them physically don't feel well, which in turn obviously can impact their performance and a whole slew of other things. But the ultimate goal I'm reminding them is, if we can get you to a point where we're tweaking and adjusting your absorption, your digestion, your motility, whatever it may be, your microbial balance, maybe there's something like dysbiosis is something that I would say is extremely common in a lot of my athletes. And as we're able to kind of rebalance the microbiome and digestive enzymes, stomach acid, when those things are in harmony, we find that we start reintroducing these, FODMAPs that a couple months ago were causing so much, pain and discomfort, and now they can enjoy these foods no problem. And the eventual end goal is to get them to a point where they have the most diversity possible, because we know in the digestive health world that the most diverse diet allows for the most diverse microbiome as well.
Yeah, great point.
So it can be very useful as a tool.
Yeah, and I would say too, like one of the areas where it's actually been shown to be some effective is with athletes, especially endurance athletes, before they're heading out for their ultra endurance events. They're like, stay away from this certain group of foods that cause, this flooding of, fermentable activity into your colon and causing some real GI distress, later on down the road, and, within a 24 to 48 hour period. Right. But so that's one area where that could probably be applied, and also be, something that would show some really good results, just with the level of activity they're doing in marathons and even in ultra marathon events and stuff like that. Any other thoughts about that, Dahlia?
No, just I'll echo Courtney in that really most of the interventions we use are tools, and as dietitians, our goal is really to get people back to being healthy and optimizing their health. We don't want people on like crazy restrictive diets. I think that's how you can tell the difference between a dietitian and not a dietitian. Is dietitians want you to eat as many foods as you can and keep things in your diet. Others might, say this is a bad food, don't eat it anymore. So.
Yeah. Love that. Great point. And you also mentioned, Courtney, without saying it exactly, but that you're really drilling down into the root cause, that there's this root cause approach of, why is this happening? Not, okay, we're alleviating maybe the symptom or this potential issue, but really getting down into, the potential to actually heal and restore and, provide a level of care that's going to enable this person to live, a normal kind of life, when maybe previously they've been inhibited by a lot, because this can be very debilitating for people, when they have chronic issues with their gut. It's not something that I feel like people handle very well socially. And they also get, really kind of just isolated from from even wanting to talk about it, or feeling like it's something that they can even discuss, because it's often not very well received, and also not something that people get a lot of help with. So, well, it's just been a really great conversation. I know there's a million things that we could drill down into, and I really, want to follow up with another segment on, just supplementation, and also just varying levels of, what we're seeing in terms of, microbiome disturbance. We've got SIBO and, the IBS, and, all the things that go on with, indigestion, and all these factors that can play a role in someone's symptoms and how they actually get diagnosed for those things. Do you guys feel like are you working interdisciplinary with other people in terms of your level of care with your patients? Yeah.
So Depends on really what the patient is working with, their client.
Yeah.
Because I see kind of a wide variety now. It just depends on, it could be a trainer, it could be a physician. I have been working with someone's nephrologist. But I do think the more we can connect as healthcare providers, the better care we can provide our patients.
Yeah.
The healthcare system needs a lot of work right now. And I
Mhm.
think it's easy to get into our silos, as medical professionals. But the more we work together, the better we can serve people.
Yeah,
Awesome.
I completely agree. I'm pretty fortunate in the sense that I work full time Tuesday through Friday at an outpatient clinic, wellness outpatient. So primary care, diagnostic testing, but it's a really well-rounded outpatient clinic, because we have everything from endocrinology to primary care, nephrology. We're working with psych. We're working with all of these other interdisciplinary care team members, which I'm very grateful and fortunate for, because we can, number one, make sure that we're communicating effectively and we're all on the same page about like the patient's plan of care and how we're going to be approaching and tackling different things. And I work very closely with a lot of the providers and physicians that my patients see, which is great, because I do agree. I think that ultimately we need to make sure that we're working with each other rather than against each other, collectively, to ultimately work towards the patient's ultimate goal of health and wellness, which is at the root of things, the ultimate goal for the patient anyway. So
Right.
we need to make sure that we're really addressing that and communicating effectively with the rest of the team.
Super. Well, thank you for those closing thoughts and all of the great information and things that you guys have shared. I mean, I think there's also this great opportunity for dietitians to continue to collaborate and share their practice experiences, because it is an emerging and changing area. And something that I know I personally look to other dietitians to help guide me, because it is not an area of expertise that I feel like I have. And so I've learned a great deal in just the last 3 to 5 years. And I know I still have a fairly long way to go, because I rely on people like you to help me with my clients when I don't feel like I have all those answers. I would like for you both to just tell us, our listeners, how to get in touch with you. Email if you prefer, a website, but just let our listeners know how they could get in touch with you, and if they want to do that.
So the easiest way to get in contact with me is either on Instagram, and my handle is Dahlia the Dietitian, separated by underscores, or email, dahlia.the.dietitian@gmail.com.
Thank you. And Courtney.
Same thing for me. Instagram is probably the easiest. My Instagram handle is fuelandflourish.rd. And for my website, it's going to be fuelandflourishnutrition.com. So I'd love to, chat and hear from you if you found any of this insightful or interesting, or maybe you have a question about gut health. I'd love to talk to you about it.
Wonderful. Well, I know that's going to be well received, and we will certainly be passing it on through my sports dietitian. We thank you so much, both of you, for your time today and coming on with us. So that's it for today's episode of The Huddle and our live podcast. Big thanks to Courtney Colbert and Dahlia Gordon for joining us today and sharing their expertise on gut health, nutrition, and performance. If you found today's insights valuable, please be sure to like, subscribe, and share with your community. And also do us a big favor and review us. We would greatly appreciate that. And until next time, keep winning. Thanks so much.